In the 1950s, doctors accidentally discovered that certain drugs made people feel better. That is, certain drugs made people high in a way that they weren't expecting. There was no way to know why these drugs were doing what they were doing. There was no way to know how they were affecting the brain. But what they did know was that when people took them, they were happy. While these drugs were being developed, there was also being developed an idea of a disease that they could treat. The cure came first. The APA came up with a list of criteria which, if you had them, you qualified for a depression diagnosis. There are 9 symptoms. If you have 5 of them, regardless of where they came from or why you have them, you're depressed, and if you're depressed, then you qualify to take the drugs. The problem, however, was that people who were recently bereaved would also show up as depressed. It has become obvious that there are other conditions under which normally people experience the symptoms of depression: loss of a job, loss of a relationship, reacting to the stressors of their lives. This is the biggest problem with the depression diagnosis in the first place. It labels way too many people as mentally ill, and here what they've done is created the opportunity to label more. In the early 1960s, the most popular psychoactive drugs, prescription psychoactive drugs in the country were the minor tranquilizers, Valium, Librium. Those drugs were routinely being prescribed for the people who these days would be getting antidepressants. The drug companies, particularly Merck, which had a drug called Elavil, were interested in trying to wrest some of the market share and marketing antidepressants to them. The marketing executive suggested that the way to increase the market share of antidepressants was to make people aware that there was a disease called depression that was much more widespread than they thought. Merck Company recruited a doctor named Frank Aide. They got Aide to write a book called Recognizing the Depressed Patient. That book was distributed by Merck to 50,000 doctors across the country. The book argued that doctors were missing the depression diagnosis because they didn't understand that patients coming in with various aches and complaints were actually depressed, which was a real physical illness, no different from other physical illnesses, and that there was a medication that they could take for it. So the idea was to create in doctors the conviction that depression was a disease, which doctors would then pass along to their patients. It was actually a very early form of what we now call viral marketing. And if you want to have a sense of how successful it was, you can see that the script that Frank Aide suggested doctors follow is the same script that doctors follow now when they tell patients that they have biochemical imbalances, which, of course, doctors, when they talk to each other, know is not yet proved. Nothing that I've written in my book means that people shouldn't take antidepressants or seek other forms of therapy for their difficulties. But they should know that they don't necessarily have a biochemical imbalance. They don't necessarily have what we normally think of as a disease. This is a myth that's been promulgated, that's been sold to us in order to help the pharmaceutical industry sell drugs and in order to help doctors help people to feel better. If you think about your unhappiness differently, you might consider that your unhappiness comes from something other than your brain. It might come from living in a very difficult world to live in, which might in turn make you think about making changes in your life or taking action that could improve the world around you.